made a post recently about 5 things I've learned as a physical therapist in 5 years, and one of those things was how important self-talk is for patients. And that sparked a lot of curiosity, so I wanted to dive a little deeper on that and give some specific examples. And this is important for both patients and doctors, so listen up. A little background on when I learned this. This was the very first thing they taught us in my orthopedic residency at Johns Hopkins. And that should tell you something. Before anatomy lessons, before manual therapy skills, they wanted us to know how important words are before we started treating patients. And they were looking at me the whole time during the lesson because they knew that I was not particularly skilled with my words, which is fair. There's a ton of research that proves the way that doctors communicate to patients has a profound effect on the patient's perception of their own body, both positively and negatively. For example, if a doctor is reading off MRI results to a patient and he's using phrases like, "This is the worst spine I've ever seen," or "I don't know how you've been getting around all these years on those knees," both of which are real examples from patients that I've treated, by the way. Using language like that will absolutely create a sense of fear and distrust in that patient within their own body, and that will come out in how they talk about their body and how they move. These are the patients that I hear saying things like, "My back is a pile of mush anymore, I'm never gonna get any better," or "My knees are bone on bone, can't take my dog on a walk anymore." That sort of talk, that sort of fear of doing those things, that is more dangerous to the patient than the actual anatomical changes. Not to say that those anatomical changes aren't something that need to be treated and strengthened, but the fear avoidance pattern that happens after patients get told these things and start talking about themselves like this is dangerous. And this isn't me saying that we need to start lying and sugarcoating everything to our patients. We can be real with them without creating fear, without creating this sense that their body is breaking down, giving them hope that the human body is extremely resilient and it is built to heal. Right? And if you do the right things, it can come back. And I feel like a lot of people are leaving doctors' offices with the sense that they're hopeless, and that needs to change. All right. So to the doctors, let's try to be a little bit better, more intentional about how we communicate with patients. This is something I'm working on too. It's not me attacking, it's me trying to be aware of it. And patients, try your best to remember this talk that we're having right now, that your body is resilient. No matter what's going on, it can get better. Okay? Positive talk. Let's go.